Joining us now from the Center for Family Health, Interim CEO and COO, Sara Benedetto, and Clinic Supervisor, Christina Henderson. Good morning.
Good morning.
Morning.
Good morning. Nice to see you.
Nice to see you guys.
Big day today
It's
for
a
Center for
big
Family Health.
day. Yeah, it's a big day. Today we reopened our Northeast Community Health Center
Nice.
at Northeast Elementary, and we've been closed for 3 years.
Wow.
Isn't that
Almost 3 years since the pandemic.
absolutely amazing?
Yeah.
So what all went into reopening?
Well, a lot of work went into staff,
Yeah.
getting staffing resources. As you know, that's been a big challenge in healthcare, especially. So, Christina's done a great job getting staff hired and on board, and so we have almost all of our spots filled, right?
Actually, they're fully filled for all
Awesome.
4 health centers.
Yeah.
We're fully
They're all
staffed
open.
now.
Everything's open.
Everything
we're
is
all
open.
Everything's open.
Everything is open.
Wow.
Yeah.
That's
Jackson High opened last week.
very exciting news. So
Yeah.
what are students able to take advantage of now that things are back to normal at those schools they go to?
So they are able to come in as if it's any other doctor's
Okay.
office. We see actually everybody. So we see primary focus though are the kids that are in the school. We want to make sure that the access is open to them during the school hours in case they need to come down, walk down. But we also see adults as well.
Oh, really?
Yeah, we see from babies to adults,
Awesome.
primary care, acute care, chronic care. We do immunizations, COVID testing, all that stuff that you would normally get at our downtown facility.
Nice.
And they don't have to be part of the school. It's just
Nope.
the community.
Neighborhood?
Yep.
Yeah,
style?
correct. Anyone is welcome. When Christina mentioned the focus being on kids and in this school, we don't turn if a student comes down and needs to be seen, we fit them in no matter
Yeah.
what. We're going to make sure that they get the services they need. But yeah, we're open to anyone.
Do
Yeah.
parents have to have permission on file with the center in order for the kids to just wander in?
Yes, they do. So we have systems in place. If they came into the health center without one of those, we can do a phone call and talk to the parent over the phone first. Then we follow up with the paperwork.
How about mental health services, Christina? Open to kids who are just kind of feeling down, really? As
Absolutely.
simple as that?
Absolutely. So we are still currently looking for a therapist for Northeast, but our other school locations have a therapist on site. They will see walk-downs, walk-ins. Confidential services are available as well for kids. And we also have the therapy open to adults as well as the community. But again, our primary focus is for the kids to be able to come in and get the care that they need, whether it's mental health, medical, whatever it is.
Yeah, we think of kids as, being resilient and made out of plastic, but in reality, they're affected by things that happen in society, like shootings.
Yes, very much
Yeah.
so. And we coordinate with the school, so if there is an incident, we can be part of the crisis team. If there is something that happens within the school that affects the students, they'll let us know, and we'll have our therapists join their staff and as well.
Even the swatting incident a
Yes.
couple weeks ago.
Yep. Yeah. Yep.
The pandemic was the reason they were forced to close the school-based health centers. So these reopening brings back a lot of the services that people were missing out on.
Right. Yeah, we know that. I mean, when we opened our school health centers initially back in 2005, we did that because we knew that even though we had services for kids at our primary location, a lot of folks still didn't make it in. It's not convenient. If you're a working parent or struggling with transportation, if we take the healthcare to where the kids are in school, that can be a big relief for parents and help with that barrier. So.
Christina, are the school-based centers, are they open just within the calendar year, or are they open year-round?
So we are open year-round.
Okay.
So during spring break, during summer break, all that, we are open year-round. We want to make sure that the access, like I said, is available to the community and not just during the school hours or, school year, I should say. So
Is it
year-round.
still flu season?
It is, although it hasn't been a bad one.
Yeah.
So flu and COVID, we're still encouraging folks, if you haven't been vaccinated, to do that, and they can get that at our school sites as well.
So kids are able to be treated. I mean, it's just like you say, it's a regular primary
Yeah.
care office. Tell us a little bit about who staffs kind of the location and what it's like as a kid walking in.
So if a child walks in from the school, they're greeted by one of our medical assistants. We normally have 2 working there. And we get them registered, we check the paperwork, they have a seat, they see the provider. And we send them back to class if it's appropriate, of
Yeah.
course. And then we also give the parent a phone call afterwards just to keep them updated on what happened during that visit.
That's awesome.
But, yeah.
Yeah.
What
Yeah.
a great service for these kids.
Oh, for the families too.
Families,
It's
oh,
like
it's
when I was in
unbelievable.
high school, our high school had an office for the school nurse, but no school nurse. So
Same.
we
We had a cop.
yeah,
Yeah,
Right.
a cot in
Secretary.
case you get a tummy ache.
we
Yeah,
just
let's
wandered
go to
in
the
and helped
cot.
ourselves to tongue depressors and cotton balls
There you
primarily.
go.
But yeah, I would think for families it's got to be just even more reassurance that
It
the
is.
kids are
Yeah.
being taken care of.
And we really work with the kids so that they can be empowered to start to learn to be responsible for their own health. I mean, obviously when you're talking about a kindergartner, it's a little bit different, but when you get up to the high school age, we want the kids to be comfortable, because by the time you're 18, you have to consent for your own care, right? So part of that is helping them feel comfortable, and we also make sure that, do they have a trusted adult they can talk to, who's the supports in their life. All of those things are screened for, so that we can make sure that we're helping them
Yeah, if a high
in the way
school-
that they need them.
If a high school student just wants to learn more about their health, that's something that they can take
Yeah.
advantage of from
Yeah.
one of the clinics.
Yeah, they sure can.
Yeah, so 2 elementary, 1 high school, 1 middle school, 2 middle schools,
2
1
middle
high school. So do you see different things at different locations?
Yes.
Yes, we do.
Yeah.
Yeah, a lot of walk downs at the older, like high school level. But we encourage that. I mean, if you're curious to come on down, if we just want to be available. So we will see anybody. We
Yeah.
do not like to turn people away.
Yeah, and that is for more than 30 years, opening the door to healthcare for all and
Yep.
That's
really
it.
going where people are. That's
Yep.
awesome. I can't imagine there's another community that has our size with 4 school-based health centers.
I don't think there's a lot. There are, there are
Yes.
some, but not many.
It's pretty cool.
Yeah,
A lot of
That's the main
people,
campus.
yeah.
yeah, a lot of people, make decisions on school for their children based on this. Let's be honest. So it's an important factor for sure.
Nice to see you both. Thanks
You
for
as
coming.
Thank
well.
you.
Thanks for having us.
Yes,
Good to
thank
be
you.
here.
What are you giving up for lunch, Sarah?
You know what? I actually was thinking about that.
I'm doing candy if you want to jump on that one.
You're giving it. Well, I did candy last year. I'm sort of thinking, but now it's public, so if I say it, I guess I have to be held to it. I'm sort of thinking about doing that no eating after set a certain time.
Oh, I couldn't even possibly
No,
consider
so
that.
I'm thinking no eating after 7. But if anyone's at night, so if anyone sees my husband, don't tell him,
That's-
because
Yeah.
I don't want him to help hold me accountable.
I could never do anything like. I would love to try that, but that's
one
when
year
I start eating.
Yeah, that's exactly
Yeah.
why I need to give it up.
One year I gave up all foods that began with the letter P. Big mistake.
Pizza, popcorn, potato chips.
Yeah, I've never heard
Ah.
of.
I didn't even think about it.
Yeah.
I've never heard of giving up a letter.
It's dumb.
Mistake.
Don't do it. Are you going to do
I'll try.
Okay, you got
Don't you pee.
Right.
Yeah.
Well, great to see you. Thank
You
you.
too.
Thank
Thanks,
you.
guys. Thanks
Thank
for having
you.
us.
Yeah, Sarah Benedetto and Christina Henderson from the Center for Family Health. More of the morning show coming up. Stay tuned.